My employer just said their healthcare costs are out of control and we need to fix this.
Yes, that's correct. They just told us we, as employees, need to work hard to make sure the company healthcare costs are going down, or else it will impact our bonus, and/or will cost jobs. They also referenced a Wall Street Journal article, which I assume is this, but I can't read that one. Suggestions on the slide. Don't go to the ER, go to urgent care, prioritize telehealth over in-person visits, use generics over name brands, talk to our physicians to reduce price or find alternatives, use mail order instead of going to the pharmacist, call manufacturers to reduce price, make sure you really need the medication.
Amazing that small business owners are not the loudest voices for universal healthcare. Small businesses get creamed on rates, and yet it is never the fault of the pro-business and anti-healthcare politicians or the greedy insurance companies, but the employees themselves that need to get slimmer, use less medication, and stop having those pesky kids that cost so much money to birth and rear. Decoupling healthcare from employment will have a profound effect on the employer/employee relationship.
Next, they're gonna do one-to-one or a company survey with medical questions to help isolate the financial risk of certain medical policies/insurance policies. Or if you have a call-in or need to leave for an appointment time, they'll give you grief. If so, I can appreciate where you're standing. However, any decisions about my medical needs will be determined by my medical team, and frankly, not only is it inappropriate to even suggest this, it could be considered discrimination to specific individuals with specific medical conditions or needs, so I suggest you tread lightly. For me, moving forward, my medical needs are not up for discussion.
Interesting that they don't have an item that says, write your senator and representative to support Medicare for all and universal healthcare. The fact they didn't mention it tells us that they want to keep employees trapped in employment with employer-provided healthcare.
Tell them in the most polite manner to ingest excrement and kindly shuffle off this mortal coil.
Ask them how they plan to do their part and advocate for affordable healthcare that is not tied to employment.
Some of those are good ideas that should have been presented in a different way. How large is your company? Are they self-funding their insurance?
Sounds like Marika, D. The telehealth one made me laugh. They hate offering telework but prefer you use telework when it's someone else's business.
Why is your healthcare any business of your employer? What country are you in where healthcare is tied to employment? It sounds like an absolutely inhumane system.
My employer switched to a new coverage plan for prescription meds. To save money, any prescription approved by insurance is now mail-ordered from Canada. Absolutely mind-blowing that the cheapest way to get healthcare in the US is to buy it from Canada.
Every day that passes we are bombarded by slavery.
Forgot the biggest cost savings vote for national healthcare, so their costs will drop. Even with the increase in taxes, it will still be lower than their total spend.
So is the company introducing any kind of wellness programs or practices? Or encouraging workers to vote for politicians that support affordable healthcare? Healthcare plans already incentivize these behaviors by e.g. charging less for generics and telehealth. If your company is having trouble with their HC choice, they can choose a different provider. If they need to save more money, it can likely come from the bloated salaries and bonuses of upper management. As if you're driving them up. What drives them up is the system. Because most employer healthcare plans means that the employer is paying those bills, not your insurance company. Considering this is the system for about 50 years. I never understand why people don't get this. If you get shot and go to the ER, your employer pays those bills. And then you pay the deductible or copay. Not too difficult. And your slides, are 50 years old as well. I don't know why you assume it's from some random article you Google. Most of the suggestions are preferable. I'd rather use a virtual appointment than sit in a germy waiting room for hours for a doctor. Why leave my house if I feel ill? It's not like there are house calls anymore. I never heard of someone not like urgent care versus a hospital for most problems. If you're not dying, your copay is cheaper too. Generic drugs? No fooling. You want to pay $50 for something that's free or $4 at the Publix. Strangest post ever on this board. Actually, it sounds like a really wacky and pointless meeting overall. What's next? Slides on how to save gas money? Business. Just die already. Do the opposite of all those things until they fire you, then sue them.
If you enjoyed this video, please check out our playlists full of similar content. Epic Aircast is like doom scrolling for your ears. Please like, share, and subscribe.